Hello, my name is Troy McComak, and today my presentation will be on the coronary artery disease and the detrimental effects. So, what is coronary artery disease? Well, we know that the coronary artery is in the heart, and a disease means a malfunctioning of that particular thing that we're referring to, which is the coronary artery. And it occurs and is often the leading causes of heart attack and uh, leading cause of death in the United States. It can be it can occur from a number of factors, being genetic, lifestyle choices, um, diet. There's a number of factors that can lead to coronary artery disease, but pretty much it is a affected part of the heart where the coronary artery gets blocked due to plaque, and that plaque buildup causes a lack of blood to flow to the heart muscle itself, and the myocardia starts to be starved of oxygen and nutrients and therefore shuts down. We're going to be getting into how this happens and exactly ways to fix it and ways to avoid it. So here we can see a normal coronary artery and where it happens to be on the heart. We can see here the coronary artery is in red and it occurs right here. So the blood would normally flow this way, and the cross section of the artery shows that everything's good, everything's healthy. This would be maybe a college student that is an athlete. Everything looks great, but the more you have a sedentary lifestyle, the more you eat bad foods, or just due to genetic predisposition, an abnormal flow starts to occur, and the plaque starts to build up on the walls of that artery. So what happens is called a narrowing of the artery, and you could see just if you think about the pipes of your heart, they're just being clogged with this plaque, and this plaque is the problem, and it was what causes this coronary artery disease. So these plaques are composed up of uh, cholesterol. Yeah, this is why they say to have a heart healthy diet is to lower your bad cholesterol versus your good cholesterol. Well, these low density lipids or bad cholesterols, they begin to form plaques in the heart. Um, and what happens is as it grows, the artery starts to get damaged, and it starts to wear on that part of the heart. It's a kind of a weak spot now. And what happens eventually would be that the plaque would rupture, and so the plaque would you can see here in this diagram, the plaque would break out of this where it's at, and it forms a portion where it just causes blood to not be able to flow. As this happens, platelets, so these dark platelets here, will begin to try and repair the artery, and that's what causes the blockage. So, and it will eventually lead to a heart attack. So these blockages are not really something that are easy to figure out that they're there. It's not something that's like, oh, okay, well, you have a blockage in your heart. Oftentimes, cardiologists can figure this out looking at different aspects of the heart, such as an EKG. However, the the symptoms are very asymptomatic until eventually the blood flow starts to be reduced, and that starts a condition known as angina or pain in the chest or the heart, and that occurs when the heart is just starved of oxygen, is starved of the nutrients that it needs, and it begins to produce symptoms that are detrimental for the health of the patient. Now, the worst thing that coronary artery disease can create is what's called a heart attack, and we often hear about this. It's a pretty common nomenclature in our modern society, and what this heart attack is an actual deadening of the heart muscle, the myocardia, and that's what they call it, a myocardial infarction. because it's literally shutting down of the heart muscle. And so here it is visualized in this representation as kind of a black spot. That's the part of the heart that's not being supplied with blood. And so that part of the heart wouldn't beat. And if that part of the heart doesn't beat, it'll cause blood not to flow properly, and could ultimately lead to death. Not every heart attack will lead to death, but a lot of it will lead to heart damage. And that heart damage is sometimes irreversible, meaning the propensity to have another heart attack or to have another, um, you know, congestive heart failure or anything like that is more likely. Therefore, it's better to avoid the first heart attack before you have subsequent ones, and to catch it early enough to where it can be fixed, where drugs can be administered and surgeries can be performed in order to make the heart function as well as possible and back to as as close to normal as it once was. So coronary artery disease being such a terrible disease and such a preventable disease, how do we avoid it? How do we avoid this? And mainly, they say it's eating a healthy diet, avoiding things like cholesterol, saturated fats, salt, and alcohol. Alcohol is a big contributing factor to this. Another concept is to quit smoking. Smoking is something that just destroys our blood vessels and our organs. It's bringing in carcinogens. It's bringing in all these bad things into our body that we just don't need them to be there, and it contributes a lot to coronary artery disease. So if you're a smoker and you want to live longer, quit smoking. Exercising regularly, so getting that heart rate up, allowing all that plaque to hopefully clear out without rupturing, using up all that cholesterol within the muscles. That's very important to avoiding coronary artery disease. And then just ultimately lowering stress. High stress increases blood pressure. It increases our heart's propensity to have a heart attack. And so by lowering our stress, by allowing us to be more calm and eating those, heart healthy diets and exercising regularly, quitting smoking, stop drinking alcohol, maybe not eat cheeseburgers every day. These things can really help to avoid this preventable disease to a degree, because it does have genetic components to it as well. So what happens when you already have coronary artery disease? It's you've gone to the cardiologist and you've determined that you have this condition. Well, first thing is the lifestyle changes. What I said before, how to prevent it. Eating a heart healthy meals, replacing certain foods with other foods, and avoiding other foods altogether. Another thing that we can do is to prescribe medication. So doctors will oftentimes try to lower the blood pressure, because the higher the blood pressure, the more likelihood is that there'll be a heart attack, because now there's more pressure on those plaques that are building up within the artery walls. And so there's drugs like metoprolol and lisinopril that can be prescribed in order to lower the blood pressure. Also, cholesterol medications like statins can be prescribed in order to bring down high cholesterol levels. Now, when it comes to the point of angina and there's problems in the heart, that's kind of a sign that there's bad things happening. So oftentimes you'll see people who have really severe heart conditions being prescribed nitroglycerin, which helps open up those blood vessels really quickly, and it causes a severe headache as well. So that's kind of like a last resort type thing, and oftentimes an older medication. People we put on blood thinners like aspirin. It helps the platelets not form if there were to be a plaque rupture. Um, Plavix is also a name brand, a blood thinner, which is called, the standard name for it is clopidogrel, and ticagrelor. I'm not very good with these names, but it's called Berlitina, and that's also a prescription drug that can be prescribed to help treat coronary artery disease. And the last case scenario for coronary artery disease, to prevent death, would be to go in and do surgery. Now, these surgeries are performed only in the worst case scenarios and is a last resort. And these surgeries are they can come in and put in a stent, which means they're opening up, physically putting a device into the artery to open it up and prevent the plaque from rupturing and causing the heart to stop, and to do a bypass. So bypassing um, the blocked part of the coronary artery going to another part of the artery. So it would just bypass that one spot, and they can keep it going to another spot. So that is another perspective way for treatment. So if you know that you have a history of heart related conditions within your family, this study here is a great example of why it's important to tell our doctors that in our questionnaires, to be truthful and explain, okay, yeah, I've had relatives that have passed away to heart attack at this age, this age, or this age. That's important because those genes, according to this 1,000 genome based uh, analysis of coronary artery disease, there are 10 loci that um, that contain the genes for our vessel walls. So there are all these different parts in our genome that code for how our arteries work, and there are 8 additive and 2 recessive that will show us how how our arteries are going to form. Additionally, to the genetic this is a common way for CAD to come about. The the genetic susceptibility uh, for this is largely determined by these little tiny genes. They call it SNPs of small effective size. So they pack a wallop, and they're very important in determining whether or not we can develop coronary artery disease. So in the future, they'll likely do a blood test to say, hey, you know what, you have this certain gene for coronary artery disease. We're going to be monitoring that. We're going to send you over to a cardiologist to get you checked out so that you don't have a massive heart attack. Because if they can, what is it? What is it said? An ounce of prevention is worth a pound of cure. So if we can figure out how to, provide that ounce of prevention, it's going to save a lot more money for insurance companies in the long run, and it's also going to help with the health of the patients that are suffering with this genetically caused disease. So when it comes to the situation of you have coronary artery disease and how are we going to treat this? Well, this study here um, by Stone et al. Has shown that putting in stents, called a percutaneous coronary intervention, was actually better than doing a coronary artery bypass grafting. So doing the bypasses, um, you know, they found that during these bypasses weren't as good as the putting in the stents. So that's kind of good news that they're being able to study this, and that there are ways for treatment for this severe disease. I know I have family members who are affected by it, and they've had stents put in, and it's helped them greatly. Um, there was no open heart surgery. They were able to do the stent through the artery of the leg, go into the heart, and pretty much leave that stent right there. And so you know, putting in these stents is kind of a good way to fix the condition once it's already started, um, and once it's there and there's no other treatment available. But a preventative measure, stopping drinking, smoking, and certain lifestyle choices like not exercising or eating really high cholesterol foods, and just allowing those plaques to build up on the heart are ways to reduce this problem that's very common in our society. So with that, I thank you very much for your time, and here are my references for my presentation. Um, Thank you so much and have a great day.